I'm Susan Field. I'm a board-certified pediatrician practicing in Alabama for 35 years, lived my whole life. About a year ago, in my private practice, the parents of a patient in my care for many, many years came with concern for their daughter. The father had taken her as helping the wife to get a haircut. He was shocked when this beautiful young lass appeared with a very short masculine hairdo. This was her way of announcing that she believed she was a transgender male. She was also unusually tired, not happy with who she was, and down about life in general. She had found many YouTube videos on how to transition, and in fact, she had found that there were complete instructions for everything a girl could ever want to know about transitioning. Fortunately, with help from a counselor and a good psychiatrist, she was able to address problems that were underneath and underlying in addition to the depression. Saw her just a couple of weeks ago. She is now a happy, beautiful young lady, thanks to her caring parents and appropriate care. In recent years, we have seen the number of children who identify as transgender as skyrocketing. I was shocked when in 2018, as you've already heard, the American Academy of Pediatrics came out with guidelines on how to treat them. In fact, in how to use the puberty blockers and cross-sex hormones. And subsequently, as you've already heard, that has been proven, as gender identity expert fact-checked the policy statement, exposed it as just systematic misrepresentation of the science. Puberty blockers can cause skin bumps, seizures, depression, personality changes. It was originally used for prostate cancer treatment. I've seen these side effects in my own father. In the cross-sex hormones cause heart attacks, strokes, blood clots, deadly things, including diabetes, and just a few more things too also. The vast majority of kids, about 84.2%, who believe they are trapped in the wrong body will ultimately accept their body if they don't get puberty blockers. The best long-term evidence we have among adults shows that hormones and surgery used to mimic the non-birth sex is associated with a suicide rate 19 times higher than the population control. Clearly, we must do something and to help these young people. Provide them loving, realistic guidance and for them and their parents, and offer counseling to explore and treat underlying issues with medicines if necessary. Harmful drugs used to block normal puberty, dangerous cross-sex hormones, and surgery that mutilates and renders individuals sterile and sexually dysfunction are not good pediatric care.